Okay, class, I'm sure you took a nice little break. Hopefully you didn't drink any Coke this morning, but I'm going to show you what happens to your body after drinking Coke. So in 10 minutes, 10 teaspoons of sugar hit your system. In 20 minutes, your blood sugar spikes, causing an insulin burst. So when you have an insulin burst, your liver is going to respond to this by turning any sugar it can get its hands on into fat. 40 minutes go by, caffeine absorption is complete, your pupils will dilate, your body or your blood pressure will rise as a response. Your liver dumps more sugar into the bloodstream. Okay, so usually when you have caffeine, your liver's going to dump more sugar into the bloodstream. So 45 minutes after drinking this Coke, your body ups your dopamine production, stimulating the pleasure centers of your brain. So 45 minutes after you drink it, you're like, that feels good. Okay, so usually you see those Coke commercials, they're like instantaneous. No, usually, I mean, it tastes good at the beginning, but usually it takes about 40 to 45 minutes for your brain to say, all right, I'm satisfied. And if it takes 40 to 45 minutes for the dopamine receptors to say I'm satisfied, in the meantime, you might have another sugar. You might have a donut with that. You might have a candy bar with that. And that really will spike up your blood sugar. 60 minutes after, phosphoric acid binds calcium, magnesium, and zinc in your lower intestines, providing a further boost in metabolism and increasing the urinary excretion of calcium. So the phosphoric acid that's found in Coke and high amounts in Diet Coke will actually bind together and leach your body's bones. And this is why I tell you that soda for a young child, especially under 2 years old, is so bad because it will leach the calcium literally out of their bones. And I'll show you how that is detrimental later on in life. And then at about 60 minutes, caffeine's diuretic properties come into play, making you pee and evacuating the bonded calcium, magnesium, and zinc that were headed to your bones, as well as sodium, electrolytes, and water. And as the rave inside of you dies down, you'll start to have a sugar crash, and you'll become more irritable, sluggish, and usually after about an hour, what do? Usually we'll get another cup of coffee, you might get another Coke, might get a Red Bull, and the cycle just continues on and on and on because you crave that sugar, you crave that caffeine, and your brain is like, yes, hit me again, hit me again. And back in the days, you probably heard this urban legend, but it was true. They used to put cocaine in Coke, and that's why it was called Coke. Obviously, they don't do that anymore, but it's still, some people are addicted like crack cocaine. It's true. I mean, people are just addicted to soda. Now, if you have a soda once in a while, once in a week, it's no big deal. But, I see when we were on campus, you guys have all these sugary energy drinks and all these sugar drinks. It's just terrible for you. So hopefully I can provide some nutritional advice for you as we go throughout the semester as well. And so the first thing you need to do is stop drinking soda. It's terrible for you. And if your kids are drinking this, or if you see your little nephew or your little brother having soda and they're under 2 years old, I'm going to show you this picture, and you're going to say, oh no, you'll stop right away. Okay. All right, so continuing on with bone growth, longitudinal growth continues as long as the epiphyseal plates are open. So here's the epiphyseal plates. Like I said, you will get taller as long as your epiphyseal plates are open. Now remember, as far as weight training is concerned, this is why we don't want kids to lift heavy weights when they're 12, 13, 14, and they're still growing. If you start lifting heavy weights, what will happen is the stresses that are placed on the epiphyseal plate, your brain and your body will say, okay, well, it's too much stress. I'll close these epiphyseal plates early, and guess what? It can technically, if you lift real heavy, you'll stunt your growth and you'll stop growing. So a lot of times, we tell kids, and people just don't understand the physiology behind it, but it's true. If you lift real heavy at a very early age, you're gonna not grow as much, and then instead of growing taller, you'll grow wider. But some football players or some rugby players or some that are looking for mass, they'll continue to do squats, lunges, deadlifts with real heavy weights, and guess what? It's going to stunt your growth. There's a lot of research to show that Now, if you look at here, if you look at the epiphyses, here's the physes, which is the growth plate, epiphyseal, and then metaphyses and the diaphyses. So this is a young skeleton. Longitudinal growth continues as long as epiphyseal plates are open. Around adolescence, plates begin closing and disappear. So if you look at this epiphyseal plate, that's not a fracture. That's an epiphyseal plate. That's an epiphyseal plate. That's a fracture. And guess what? That's a fracture along the epiphyseal plate. This is not good. This person is going to have a long road to recovery, and most likely this leg will be shorter than the other because this will close prematurely and they'll have a leg length discrepancy. So if you like to snowboard, if you like to ski, this is the injury. So this was a patient that went to Mammoth and unfortunately fractured their, well, you can see, if you see which bones, you've got the tibia, the fibula, that dislocated their talus. This was tough. This was about a year recovery. Okay, more than that. Now, most close by the age of 18. So most of your epiphyseal plates will close. This is a good test question. Close by age 18, but some may be open until the age of 25, usually in your vertebral column. So you can still grow an inch or two even after 18. So if you're past 18, you're thinking, oh, I'm not going to grow anymore. Maybe. But if you're really into sports and you really have put a lot of impact on your bones, then you're probably done growing. Growth in diameter continues throughout life. Like I said, once you stop growing up, you start growing wider. So there's only one way to go, and that's wider. So you have to be careful. So if you have plants at home, and if you want your plants to grow wider, then you can start trimming the top. Right? So just trim the top, and guess what? They'll get wider and wider. So that's a good way to get your plants to be thick in the middle there. So just keep trimming from the top. Now, the internal layer of the periosteum builds new concentric layers on old layers. So simultaneously, bone around the sides of the medullary cavity is reabsorbed so that the diameter is continually increased. Now, here's a good quiz question. Osteoblasts, cells that form new bone, and then osteoclasts, cells that resorb old bone. Okay. Now, bone properties. It's composed of calcium carbonate, calcium phosphate, collagen, and water. So 60 to 70% of bone weight is calcium carbonate and calcium phosphate. The other 25 to 30% of the bone weight is mostly water. So water is important, but calcium carbonate and calcium phosphate is very, very important, 60 to 70%. So if you continue to drink soda and it's leaching the calcium from your bones, then the bones become brittle. And I'm going to give you, if you watch the NBA, I'm going to give you a few examples of what happens when you try to build a skyscraper on wooden stilts. And this will make sense as I show you that a lot of these athletes that have become NBA stars, you have to think they came from poor families. So if they had a very poor raising and they didn't get the proper nutrition at ages 1, 2, even 3, 4, then you're going to see these severe accidents. And we'll talk about it, and I'll show you some of these. You're like, how can that happen? That's because they had very poor nutrition at a very early age. Collagen provides some flexibility and strength in resisting tension. Aging causes progressive loss of collagen and increases bone brittleness. Most outer bone is cortical. Cancellous bone is underneath. Cortical bone, which is 5% to 30% of volume, is porous with non-mineralized tissue. Cancellous bone, which is spongy bone, with 30 to 90% of its volume being porous. Cortical bone is much stiffer and can withstand greater stress, but less strain than cancellous bone. And cancellous bone is spongier and can undergo greater strain before fracturing. Okay, so that's very important to understand that cortical bone is stiffer, but it can withstand greater stress, and cancellous bone is spongier and can undergo greater strain before fracturing. So depending on the amount of cortical bone you have versus the amount of cancellous bone, then we can say which bones are more resistant to fractures. Now, Wolff's law is a very important law. Bone size and shape are influenced by the direction and magnitude of forces that are habitually applied to them. So if you continue to have compressive forces, then guess what? Bone will reshape themselves based on the stresses placed upon them. Bone removed here and added here. So bone is a dynamic tissue. What does that mean? Wolff's Law holds that bone will grow or remodel in response to the force that demands it placed on it. So use it or lose it. Okay, so when these NASA astronauts go up into space, they're not putting that pressure on there, so they come back with bones that are brittle. So they have to find ways that they can put stress on these bones to continually grow. Bone mass increases over time with increased stress. Now, if you look at this, Wolff's Law, what happens is patients that are extremely overweight, if you look at they're either bow-legged and they can put stress on different areas, and then you'll see that their bones will be deformed due to that excessive weight. And I'm not talking about 10 or 20 pounds, but we're talking about 40, 50, 60. No, I'm talking about 200, 300 pounds overweight, and they'll have a deformity in their bones. Let's look at some bone markings. Again, this is a review of anatomy, processes including elevations and projections. Okay, here's the femur vertebrae. You have a condyle, facet, and a head. Again, this is Anatomy 101. We're just going to briefly go over this. Processes to which ligaments, muscles, or tendons attach. The crest, epicondyle, line, processes, spine or process, suture, trochanter, tubercle, tuberosity. This should all make sense to you. This is nothing new. Cavities or depressions include openings and grooves. You have a facet, foramen, fossa, fovea, meatus, sinus. So you should know what all these are. Again, if you took anatomy, you should definitely know what all these are. And look at that. Football, America's game. Ugh, that doesn't look very good, does it? Okay, so I'm going to show you another image from basketball. And you probably remember this injury here. Alright, so you can see this is the terrible triad. Probably has a fractured fibula, torn ACL, meniscus here. Now this is a fluke thing, right? Somebody falls on you. This is a fluke thing. But for, if you remember the Kevin Ware injury, yep, that's his tibia right there. I know, I'm sorry to show you this graphic picture, but they interviewed the orthopedic surgeon that did this surgery, and they're saying, well, how does that happen? Well, he said, unfortunately, the first 2 years of life, guess what? If you don't have proper nutrition, the bones are very porous. Okay, so this is where it goes back to you can't build a skyscraper on wooden stilts. He had a very poor foundation, so no matter, imagine all the running he does, the jumping, the constant tension that he has, that he got micro fractures all over, and then finally it gave. Okay, so this should be a wake-up call for you. For some of you, it's too late. You're obviously more than 2 years old. But if you have kids, do not do this to your kids. Okay, do not give them soda. Do not give them sugar. Do not give them anything like that the first 2 years of life. You give them the most healthy foods that you can. Take care of them, and really, it's on you. So do the best that you can, and guess what? They'll be fine if you give them the proper nutrition. So with that, let's end the day, and you can have this as a visual for the rest of the day.